Hello, relatives. Welcome to this week's Schlagbite for the week May 26th, 2014, entitled Big Money Bleeds Healthcare. So, in the last week, there's been more news that Blair's another doctor is bilking insurers out of millions of dollars. This fraudulence disgusts me. But let's all be clear that a doctor's income is not the big cost in our healthcare delivery system. Those who oversee the business of medicine, not the hands-on caregivers, those are the ones who earn the big bucks. The average base pay for an insurance company exec is $584,000 a year. For a hospital CEO, $386,000 a year, as compared to a family doc who earns $156,000 a year. As an industry, healthcare is staffed by some of the lowest paid professionals. The average nurse earns $61,000 a year. An emergency medical tech, an EMT, earns $27,000 a year, which is about minimum wage. And if they have families, have to work 3 jobs just to make ends meet. The United States spends 20%, almost, of its gross domestic product on healthcare, more than any other country in the world by 7-fold. And yet we are not the healthiest country in the world. We're not even in the top 20. The administrative costs in healthcare make up 30% of the U.S. healthcare bill, which is twice as much as any other developed country. We will lower the costs of healthcare in this country if we reduce the administrative costs. The current reimbursement system is so complex, it requires specialists in everything other than hands-on care. There are jobs now that feature specialists in coding, in claims adjusting. There are medical device brokers and drug purchasers and navigators. We need to put healthcare back in the hands of those who actually care for patients and who want to do well by them. If we can't get a single-payer system in this country, let's at least elect legislators who are not bought by industry lobbyists representing big pharmaceutical companies, the device manufacturers and suppliers of every description, and pass laws requiring insurers to spend 95% of the premiums they collect on actual medical care. The truth is that most doctors want to do well by their patients, and they still come to work as if it's a ministry, not an industry. On this Memorial Day weekend, remember those people who have sacrificed themselves so that we can live in a nation that reminds us that we can say, be, and do what we truly are without fear of retribution. Have a great weekend. I say this for all my relations. Mitakuye.